A podiatrist treated a patient for 9 years. She knew her history. She ordered the right imaging. She made reasonable clinical decisions. And she still ended up in a lawsuit that lasted nearly a decade. This is case closed. And here's what every podiatric provider needs to learn from it. The patient was a 39-year-old nurse with a complex medical history: lupus, diabetes, neuropathy, DVT, and severe spinal stenosis. She had been successfully treated by the insured for multiple podiatric conditions over 9 years. In November 2011, she presented with acute onset pain and swelling in her left foot. No recalled injury. The insured obtained an X-ray, which was negative for fracture, placed the patient in a CAM walker, and planned to consider an MRI if symptoms didn't improve in 3 weeks. At the 2-week follow-up, the patient continued to report severe left foot pain. The insured documented an evaluation of her toe ulcers, but did not document a reassessment of the left foot pain. The patient was kept in the CAM walker for another 2 weeks. At the next visit, the foot was collapsing. The insured recognized Charcot, ordered an MRI, then a CT scan, and appropriately escalated care. The patient then transferred to an orthopedic surgeon, who treated her conservatively and resolved the Charcot foot. Just under 2 years later, the patient filed a lawsuit. The lawsuit alleged 3 things: failure to timely diagnose Charcot foot, inappropriate treatment with a CAM walker instead of a below-the-knee cast, and failure to properly treat a Charcot deformity, causing permanent disability. The defense retained 2 podiatric physicians and an orthopedic surgeon, all of whom agreed the insured's treatment was within the standard of care, with no evidence of delayed diagnosis or treatment. The jury returned a verdict in favor of the defense. But here's the point. The insured won and still endured years of litigation stress. A defense verdict is not the goal. Prevention is. So, where did the exposure come from? Not from the clinical decisions, but from the documentation gaps surrounding them. At the critical 2-week follow-up, the insured addressed the patient's toe ulcers, but left no documented reassessment of the acute left foot pain. That gap became a liability. On weight-bearing instructions, the insured stated in deposition that she told the patient to be non-weight-bearing. The patient testified she was told limited weight-bearing. Neither version was in the chart. That contradiction, a direct he said, she said, was entirely preventable. There was also no documentation of whether the patient was adhering to instructions. In a complex patient like this one, adherence documentation isn't optional. It's your evidence if outcomes fall short. A 9-year patient relationship, sound clinical reasoning, and a winning defense, all put at risk by what wasn't written down. PICA identified 6 protective practices from this case. Here are the 3 highest impact ones. First, document your clinical rationale, not just your decision. If you consider Charcot as a diagnosis, document why you chose a CAM walker over a below-the-knee cast. Document your weight-bearing recommendation explicitly, and document it in the chart, not just in your memory. Second, document patient instructions precisely, and document adherence at every visit. If a patient is not following your recommendations, that belongs in the record. It establishes the patient's contribution to any adverse outcome and protects you when accounts conflict. Third, reassess and document every active complaint at every visit. When this patient returned with ongoing left foot pain, the visit note addressed her ulcers, but went silent on the foot pain. Every active complaint deserves a documented reassessment and an updated plan of care. 3 things to take from this case. Winning a lawsuit is not the same as avoiding one. Documentation is what keeps you out of court in the first place. The most dangerous gaps in a malpractice case are often not clinical errors. They are what you did not write down. And lastly, complex patients require meticulous records. The more comorbidities, the more documentation detail you need at every single visit. PICA's case closed exists so that other providers don't have to learn these lessons the hard way. Download the full case closed publication and explore our risk management resources at picagroup.com. Because the best defense starts long before a lawsuit is filed.